Sleep apnea affects millions of Americans. Some have such severe cases that it can kill them.
Yeah, pretty serious issue. New trend that some people are following to keep from developing it. We'll get to that trend here in just a minute, but Dr. Payal Kohli is here. Dr. Kohli, let's talk first off about sleep apnea. What exactly is this? I think a lot of folks probably assume they have this, but maybe don't.
Yeah, no, it's hard to know. So it's exactly what it sounds like. It's apnea or lack of breathing during sleep. And there's two things that can cause it. It can be your brain that forgets to breathe. That's called central sleep apnea. Or it can be your tongue or something else that gets in the way. So as we get older, we put on a little extra weight. Our facial anatomy changes, especially for men. Our tongue can actually roll backwards when we lie down to sleep, especially on our back. Our neck muscles can relax, and that can cause compression of the airway. So if oxygen's not getting in, your body's in a little stress response all night long, and that can manifest with high blood pressure, cardiac problems, arrhythmias, electrical problems, and even a whole host of symptoms.
How do you treat this? Is there a treatment?
There is treatments, yeah. So the first thing is you have to pick it up. So there are many, many Americans, especially in Colorado, walking around not knowing that they have sleep apnea because it can sneak up on you. So the obvious signs and symptoms, your partner tells you you're snoring, they keep nudging you awake all night long, or you wake yourself up. It's not the snoring that's waking you up, it's the lack of oxygen that's actually waking you up. You have a headache, you have a dry mouth, you're irritable, you're crabby, you're fatigued. These are all signs that you could have sleep apnea. So we have to look for it, test it by doing an oxygen test overnight. And that can be, even your smartwatch can do it. That's called the poor man's sleep apnea test, what your oxygen is when you're sleeping. But we'll do formal testing. And then if we do find you have it, then we treat it. Sometimes you can get away with those nasal strips. Have you guys seen those?
Oh, yeah.
Yes.
Not only
do they work?
Not only do they look good, they actually tent your nostrils open so that more air can get in. So if it's extremely mild, you can try the nasal strips. Sometimes the dentist will make an appliance to kind of pull your tongue out of the way if you have a very mild case, like a mouth guard type of a thing. But in the more severe cases, it's a machine called CPAP, continuous positive airway pressure. It pushes air in to kind of make sure that you're breathing at night.
We have like 30 seconds, but I have to ask you about this trend because I just saw it on Love is Blind the other day, and this man was taping his mouth shut. Is that a thing, or is it total
So
BS?
I have had so many patients ask me about this. I've not seen it on the TV show, but I have had patients
You haven't tried
ask me.
it? Yeah.
So the idea is you tape your mouth, you force air to go through your nose, so your tongue's kind of not getting in the way. But here's the problem. What if you have a problem with your nose? You've just taped one of the two ways that air gets in, so it's really not recommended for air to get in because you could choke while you're sleeping. You're essentially closing off your mouth, your airway, especially if you're a mouth breather. And you're supposed to be a nose breather when you sleep because it warms up the air, it filters the particles. So the idea is to force your nose to breathe, but it doesn't work. And secondly, what if something needs to get out? For example, you wake up and you need to vomit or throw up. You've got your mouth taped shut, and that could really increase your risk. So even though they're doing it on Love is Blind or whatever, do not do this because it is not safe and not recommended for sleep apnea at all.
Advice, leave the tape in the drawer.
Okay. You heard it here first.
You heard it here first. Well, you can find more with Dr. Kohli at 9news.com/Dr. Kohli.